Indiana in the morning on WCCS AM 1160, FM 101.1, brought to you by First Commonwealth Bank. We're all set to Meet the Doctors, part of the IRMC Indiana Physician Group, and we're going to talk this morning with Dr. Kolby Mumau, a chiropractor at IRMC's Physical Group. Good morning and welcome.
Thank you.
Tell us a little bit about yourself, your background. I know you grew up in the neighborhood, so you're local.
Yes. I'm from Punxsutawney, PA, born and raised, but now I'm here in Indiana, and I love it.
Okay, and what made you want to go into chiropractic medicine?
It's a good question. I actually hurt my back whenever I was younger, and chiropractic medicine was the only thing that actually helped me out long term.
What type of training? How many years does it take you to go through that process?
Sure. So after high school, I went to University of Pittsburgh 4 years, and after that, I went to New York Chiropractic College up in the Finger Lake area, which is beautiful, and that was about 4 years after that.
And you've been practicing for how long?
I graduated in 2013, so since then, and I just joined IPG here in May, and it's been wonderful since.
October happens to be National Chiropractic Month. Tell us a little bit about that. What special events are taking place?
Yeah, so October is National Chiropractic Month. Unfortunately, October is getting towards the end here, but we've been celebrating all month here at our office. We've been giving out free assessments, and because it's been so successful, we're actually going to extend that into November as well for free assessments. But the month is basically to celebrate chiropractors and to get you back in health with your spine and so forth.
So those free assessments are being held where?
At our office. We're at the Human Motion Institute in at RMC 120 IRMC Drive.
Mm-hmm. Okay, and the hours would be?
Well, I'm there until 3 today, but I'm there mostly from 9. I start 9 every day, but I go to 6 most days.
Okay. Do you need to make an appointment ahead of time, or can you just?
You can call in. Most appointments can be made same day. We'll try to fit you in no matter what, but yeah, you can call in or you can go online as well.
Would you happen to have that phone number?
I do. 1-888-452-IRMC, or you could visit irmcdocs.org.
For our listeners who might not be aware of all the different things that chiropractors do in their medical services, fill us in on some of those things.
Sure. So a lot of people in Indiana know what chiropractors do, but for those out there that don't know what they do, what basically is we try to provide pain relief for patients or people that just hurt themselves with their spine, their back, their joints, their muscles, without the use of drugs or surgery, and try to get them better and move better overall.
Now, sometimes you don't have to injure yourself. Just the process of getting old, I would think, might cause some back problems, right?
That's true as well. A lot of people, as they get older, they get arthritis. They don't move as much. We sit around a lot during our day as well. So providing that extra motion to our joints and muscles, that helps a lot.
And I think a lot of people probably associate chiropractic help with those in their elder years, but that's not so, is it?
That's very true. So I actually see younger patients that may have hurt themselves during sports or even the regular people that just sit around in their office that middle-aged that get aches and pains just from sitting on their computers or sitting at home. They can get aches and pains as well.
Now, I remember back when my oldest daughter was probably less than 3 years old, she was having some problems with colic, and it was suggested that we visit a chiropractor, and we did, and basically what he did was he massaged a certain muscle in her back, and after a couple of visits, it was gone.
Yeah, there's times where that can be helpful as well. See just about all ages, and that's one thing that's great about the profession is that you can see about any type of condition with the muscles and joints, and it can be beneficial most of the time.
Are there signs that people receive or something that's not feeling well that might indicate that they should see a chiropractor?
Sure. A lot of aches and pains during your day, walking, sitting. I mean, obviously, if you're having pain, shooting down your arm, shooting down your leg, that's definitely an obvious sign that you need to be seeing somebody. But headaches as well. But I mostly treat the spine, though I do treat shoulders, knees, hips as well. But spine's basically the chiropractor's specialty. So anything that's going on with that, if you're bending down, picking something up and it hurts, you're sitting and it hurts, walking and it hurts your spine somewhere, whether it's your neck, your mid-back, your low back, then those are pretty good signs that you should probably be seeing.
We're talking this morning with Dr. Kolby Mumau, chiropractor at IRMC's Physician Group. Is there one thing that you've come across that you work on, you find that you're doing this more and more often, or is each person, their problems, are they individual?
Well, definitely there's individual care to each patient that comes in. I'm actually, lately, there's been a lot of low back issues, and that's due to just around this time of the year. Some people can be a little bit more active as it gets colder. During the summer, we're a lot more active, so our muscles and everything are a lot more warmed up. We're exercising more, but during the colder weather here, we get a little lazier, I'd say, and basically our low back starts to get fatigued easier, and so yeah, that can take a toll on us. So I've been seeing a lot more low back pain lately. And
when we look out the window, whenever that happens, and we see that there's snow on the ground, and we have to get the shovel out.
Right. Yes, that's one of the most common things during the winter, or little slips and falls from the ice that can happen as well.
Now, for folks who have never been to a chiropractor, can you go through the process, what that first visit is like?
Sure. So if you would come in to see me, basically what I'd get your detailed, comprehensive history, because your past kind of tells you exactly what might be going on. So if you are sitting for a while, that can be a clue. If you're hard at work all day with construction, that can be a clue. So getting the detailed history first is most important. Then after that, I go through a physical exam. Basically, I check out what's working well, what's not working well, checking to see if any areas are dysfunctional, basically that if they're not moving as well as they should be. And those can kind of tell me basically what might be going on with you. And then I kind of tell you what we do treatment-wise. And that can be anywhere from adjusting the spine, which chiropractors are most known for, and but also I also provide other services such as exercise or modalities such as ultrasound and heat, and as well. So I have a wide variety of things that we can provide for treatment.
Are Xrays part of your process?
If necessary. If necessary, I don't believe that X-rays need to be performed on every single patient, right. But those that have trauma or that are older that have signs that should be X-rayed, then definitely we'll send them out.
Is there a typical number of visits that a person usually makes to a chiropractor? Or again, does that depend on the individual?
It definitely depends on the individual. Some patients can get better in one visit. Other patients can take a little bit longer. Those that might have been in a car accident, those have been having issues for 5-10 years, those visits usually don't take 1 or 2. It kind of might take a little bit. Usually if it takes a while it took a while to get you into that pain, sometimes it might take a while to get you out of that pain as well.
So not only can you help alleviate the problem, but you can also set up a program, maybe an exercise program or something that the patient can do to help prevent further dysplasia or injury, right?
Right. And that's what I believe sets me apart from other chiropractors here in town, is that some of the older chiropractors might have just done what they did right out of school. I like to stay up on the latest research and do the newest and best treatments that I can, whether it's exercise, certain types of manipulation, so forth. But I believe that I wouldn't have the backing of the hospital if they didn't trust me.
Now, are things moving pretty quickly in the chiropractic field?
Yeah, I mean, there's always new stuff coming out for low back pain, what's best for it, especially pain like radiculopathy, which is basically the pinched nerve that you hear, the sciatica, the pain shooting down the legs. There's always new things that come out with that to say what's better, what's not better. And I always will work with your primary care physician or other physicians as well, since I have a good relationship with a lot of them here in town.
Now, I have a note here that says you work with hockey players.
Yes, the IUP hockey team.
Okay.
I'm their team doc, and I work with them all season, help them get out of aches and pains, because they are one of the most injury-prone sports because they beat themselves up day in and day out. So it's definitely been helpful for them, and it's been a challenge for me as well.
You see many football players?
Yeah, I mean, I actually treat one of those Saturday morning clinics that go on. We see a lot of football players coming in those mornings. Knee injuries, those some type of knee injuries, ones that are really bad, ankle injuries, we'll send those out. But those with spine pain from getting hit all the time, I definitely see those a lot as well.
So basically, there's really no age limit that a chiropractor can help with, and it just depends on the specific person, what those problems are.
Right.
You mentioned your free screening.
Yes,
that's
yes.
going on. I think we should go over that once again.
Sure. So for all the month of October, to celebrate the National Chiropractic Month, we are giving out free assessments. Basically, a patient come in, kind of talk to me about their aches and pains, and then they can decide where they want to have treatment. But since that was so successful in October, we had a lot of those. Would like to extend that into November then as well.
And that takes place at the Human Motion Institute at IRMC, 120 IRMC Drive, Suite 100. You can call, make an appointment. Let me see if I got the number right. 888-452-IRMC.
Correct.
Right?
And then you can also go online as well. That's www.irmcdocs.org.
All right. It's Dr. Kolby Mumau, chiropractor at the IRMC Physicians Group, joining us this morning here on Indiana in the Morning. And also the IRMC Physician Group has Saturday mornings injury clinics that we've been talking about on the radio, right?
Right. And those are great ways for people that have just aches and pains. It's not just the sports clinic anymore. We were just before having just a sports clinic for those that got hurt, aches and pains for the football players, hockey players, basketball players, all those. But now we've extended that into the everyday person, weekend warrior type of thing, where hurting themselves, doing something maybe they kind of extended themselves a little too far for. But anybody can come in, usually Saturday mornings. I'll be there some weekends. Then we have some of our other providers there on weekends as well, and they can point you in the right direction.
All right, Kolby, thanks so much for stopping by. We continue with Indiana in the Morning. We'll check our Fox News report coming up, and then our Indiana County report for this Tuesday morning.